Hi everyone, my name is Elizabeth Brooks. I'm a second-year pharmacy student at UNC, currently on rotation at the Cone Health Family Medicine Center. Today I will be going over the latest pharmacy news for the month of March. For this month's news, we will discuss the recent approvals of Kevzara for polymyalgia rheumatica, Zavspret for migraines, and an approval for an over-the-counter naloxone nasal spray. We will also discuss two important updates from the P&T meeting that you can expect to see go into effect in late April 2023. Finally, we will provide an update regarding basal insulin on the Medicaid preferred drug list. The first approval we will discuss is the use of Kevzara for patients with polymyalgia rheumatica. Kevzara, or sarilumab, was approved as the first biologic product for adults with PMR who have had an inadequate response to corticosteroids or who cannot tolerate corticosteroid taper. The dosing is 200 milligrams subcutaneously every 2 weeks in combination with the tapering dose of corticosteroids. It is available in single-dose pre-filled syringes or pens. Like many biologics, there are risks for serious infections, and we want to avoid use in patients with neutropenia. Risk of gastrointestinal perforation may be increased with concomitant use of NSAIDs or corticosteroids, and you want to avoid any live vaccines with usage of Kevzara due to infection risk. Kevzara is the first biologic approved for polymyalgia rheumatica, and prior to this, the mainstay treatment has been corticosteroids. This can be used for patients with an inadequate response to corticosteroids or who cannot tolerate a corticosteroid taper. The next approval we will discuss is the use of Zavspret or Zavegepant, a new CGRP antagonist approved for the acute treatment of migraines. Zavspret is only approved for acute treatment for migraines with or without aura and is anticipated to be available in July 2023. Zavspret is the first non-oral gepant in the drug class of CGRP antagonists. The nasal spray contains 10 milligrams, which is the dose of the medication as well. A take-home point is to avoid use of intranasal decongestants, and if unavoidable, administer intranasal decongestants at least 1 hour after Zavspret administration. This table shows the different gepants and their approved indications. Nurtec is unique in that it can be used for prevention or treatment. Zavspret is shown to have the quickest onset between this drug class at about 30 minutes to peak and is the only nasal spray formulation. As you can see, these medications are all fairly new to market. This medication is used for patients with more than 6 migraines per month or who are unable to tolerate other options such as triptans. It could be considered earlier for patients with nausea or vomiting with migraines who cannot tolerate oral medications. The last approval that we will discuss today is the recent approval of a naloxone over-the-counter nasal spray product. Naloxone, or Narcan, is a life-saving medication that rapidly reverses the effects of an opioid overdose, which is a major public health issue. Previously, Narcan has only been available by prescription, but the FDA has now approved an over-the-counter product. With this medication now being OTC, accessibility and location availability will be improved. This may take months to see come into effect as the manufacturer determines availability and price. We will now discuss a few updates from the Cone Health Pharmacy and Therapeutics Committee meeting from March. Previously, the recommendation for IV levothyroxine in patients unable to tolerate PO meds who were on levothyroxine prior to admission was to wait 72 hours since the last oral dose. Due to pharmacokinetics and literature recommendations, the new approved recommendation is to initiate IV continuation therapy 7 days after the last oral dose, with a few exceptions. The previous recommendation also included using 50% of the patient's previous oral dose as the IV dose, which has now been changed to use 75% of the oral dose as the IV dose. Intramuscular ziprasidone for acute treatment of agitation in schizophrenic patients has been on Cone Health formulary with a previous restriction to emergency department physicians and psychiatrists only. Use of this medication has been rising, and to avoid delay of care, the restriction limiting hospital prescribing to only emergency department providers and psychiatrists has been removed. We are now going to discuss the North Carolina Medicaid Preferred Drug List update on basal insulin. The Preferred Drug List, or PDL, provides information on preferred and non-preferred medications for every drug class for Medicaid patients. You can access it from this link. A few weeks ago, North Carolina Medicaid recently updated the Preferred Drug List to remove Lantus from preferred and replaced it with generic insulin glargine. This created a lot of problems for patients who were on Lantus as the pharmacies could not fill it for them. Due to so many access issues with Glargine, they have now added Lantus back to the preferred list. Insulin Glargine is the authorized biologic for Lantus, and it's cheaper, but due to these accessibility issues, both will continue to have preferred status. Insulin Glargine is the unbranded, long-acting insulin biologic identical to Lantus, and both are manufactured by Sanofi using identical manufacturing processes. SoloStars are disposable, single-use, pre-filled insulin pens. As mentioned, Lantus was previously removed from the preferred drug list and generic insulin Glargine was put in its place. But due to access issues for patients, Lantus is back on the PDL, so physicians can continue to prescribe Lantus for their patients with Medicaid for the time being. You can use non-branded and branded in SoloStar form since March 24th. This is a recap overview of everything that we discussed today for the updates this month. Special thanks to Dr. Koval, Madison Yates, and Brianna Belden for contributions to this month's updates.